On today's Dr. Alex Answers video, I discuss, is it okay for a puppy to have an anti-rabies injection at the age of 2 months? My final question is it okay that a dog has been injected with an anti-rabies shot at the age of 2 months? Well, age of vaccination is definitely something to think about, and really different vaccines are licensed for use at different ages and with different protocols, so it really depends on the vaccine. You know, then depending on which country you're in, which state you're in, certainly if you're in the US, then there are then different legislative requirements which detail when rabies vaccination must be given, and these two things aren't always the same, so the vaccine license doesn't always tie in with the state legislation. So it might be that a vaccine is able to be given earlier, and it's actually maybe beneficial to give it earlier, but then the state legislation requires that a vaccine is actually given a little bit later. So that may mean that you decide to give a pet more vaccines than they may strictly need, just to satisfy that early risk while they're young, and also the legislative requirements as well. So with the rabies vaccines that I'm familiar with, they can definitely be given from as young as 4 weeks of age, but they'll always require that final initial vaccination course or even single vaccination to be given at 12 weeks of age or older. So if a dog is being vaccinated at a younger age, so at 2 months here, so 8 weeks, then they will need a second vaccination at 12 weeks of age or older, like I say, to also comply with that state legislation. And really it's a risk-benefit assessment. So we want to give the vaccinations that a dog needs without over-vaccinating. So if the risk of rabies is incredibly low, so if you're actively supervising your young puppy, you're not letting them mix with wildlife or unknown dogs, other unknown animals, then giving an earlier vaccine is probably not going to be needed, because the risk of them contracting that disease, and this is the same with parvovirus or distemper or any other of these kind of vaccine preventable diseases, then, you know, if there's really a low risk, then we don't need to worry about vaccinating them really early. Having said that, if there is a risk, if there is known problem in the area, if there's a outbreak, if there's a flare-up, or if the lifestyle of you and your dog means that they are going to be in high-risk situations, then getting them that earlier vaccine is definitely going to be beneficial, because with a lot of these diseases as well, really young pups are super sensitive to these things, and they have often have a high fatality rate. Obviously rabies has pretty much 100% fatality rate anyway, but certainly if a dog has got rabies, then they're going to need to be euthanized, because that's a massive human health risk, and that's something we definitely don't want to overlook. So really talk to your vet about the local risks for your dog in conjunction with your lifestyle as well, and then also discuss what the legislation means that your dog will need later on if they have had that earlier vaccination. So we definitely want to think of both of those things so that your dog is both safe and also complies with whatever laws are around where you live.
You've been watching the Dr. Alex Answers video podcast. Remember to subscribe and head over to dralexanswers.com for any links, downloads, and get your question answered.